Hi, my name is Allison Adams, and I'm going to be talking about equine pituitary pars intermedia dysfunction, also known as Cushing's disease or PPID. So the reason I chose this topic is because my horse, Willie, he actually has Cushing's disease, and he was diagnosed about 2 years ago. So these photos, he was around 12 years old, and he was super healthy. And now he is in his early 20s and he has had Cushing's disease, like I said, for about 2 years. So I'll be using these photos as a reference to see kind of what he looked like before versus what he looks like now that he has the disorder. So what is equine pituitary pars intermediate dysfunction? So it is an age-related chronic neurodegenerative disorder that is physiologically caused by hyperplasia of the pituitary gland, which is enlargement, or a benign tumor on the gland that causes an increase basically of cortisol. So the increase of cortisol is caused by the hyperplasia that pushes on the pituitary gland and results in the lack of inhibition. So there's a hypersecretion of ACTH along with other hormones. And the ACTH and cortisol is probably the most important of these hormones that are oversecreted because the heightened cortisol results in the horse's body believing that it is under stress constantly. So the body responds as if that were the case. Also, the aerobic stress and the neurodegeneration of the dopaminergic neurons of the hypothalamus result in a decrease of dopamine production, which then contributes to the inability to regulate the pituitary pars intermedia. So the decreased dopamine levels increase the growth of the cells in the pituitary pars intermedia, and that also increases the hormone levels. The symptoms of this disorder are pretty severe and can be extreme. First is the most notable, which is the long hair coat. They have curly, long hair and inability to correctly shed. So going into the summer, spring, warm months, they carry a lot of that winter hair still around. This picture is my horse, Willie, and as we're transitioning into the spring and summer, you can see how he has really long hair on his legs and then almost no hair up here on his shoulder area. And the super long coarse hair is also key part of the disorder. So because they have all of this excess hair, that combined with another symptom, which is excessive sweating, they have a lot of trapped bacteria on their skin. They can get fungal infections, and they have a really hard time cooling down and regulating their body temperature. So another symptom would be depression and being lethargic. That can be contributed to the decreased levels of dopamine. They also have insulin resistance, and they lose a lot of their muscle mass, especially along this top line. And also a pot-bellied look appearance is key to Cushing's disease. They have increased risk of laminitis. They have decreased immune function. So anything that happens to them, injury, sickness, it's going to take forever for them to heal. They have hoof problems such as divergent rings or separation of a white line that's up here. The laminitis is seen down here, and the laminitis can occur to them so frequently, and it also ends up, unfortunately, being the cause of death for a lot of these horses. So diagnosing Cushing's disease, you wouldn't think would be so hard because the symptoms are so extreme and easily seen, but also it can often go undiagnosed or can be diagnosed really late due to the fact that a lot of these symptoms coincide with simply symptoms of the horse aging. And a lot of these horses are seniors, so that is a problem. But the way it is diagnosed is the ACTH levels are assessed in response to a TRH injection. So the ACTH levels are assessed before and after the injection, and then horses that have unchanged levels of cortisol will be positive for Cushing's disease. So predispositions, there are no specific predispositions. That we know that females are more likely to get it than males. There's not one breed specifically that gets it more often than others, but we do know that aging is the only proven known correlation with onset. There's a possibility that horses that have pre-metabolic disease can develop it, but overall, mainly just aging. And then 20% of horses over the age of 15 do have PPID. So prevention, there's no direct prevention due to the fact that we are not entirely sure of the cause other than aging. But early diagnosis is key to starting treatment as soon as possible. And then we can try to prevent pre-metabolic disease, and we can try to adequately manage their feed programs. Once they do have the disease, how do we manage it? So they can actually live a pretty high quality life if they're managed properly. Paraglide medication can be given every single day. My horse is on it. It is a pill, and it mimics dopamine in the body to try to increase the dopamine, regulate their other hormones, and overall reduce their clinical signs. And it does a pretty good job, and the horses can actually live pretty normal long lives if they are on this medication, as long as they respond appropriately. So they should also have regular dental care because they have decreased immune systems, which leads to common or frequent infections of the teeth. Clipping their hair can help because that will reduce or help them regulate their temperature and reduce their risk of getting funguses and being super uncomfortable. Also clipping their hooves to try to reduce their risk of laminitis. It's also super important to feed them a diet of low starch and low sugar to try to reduce their insulin spikes. Overall, their life expectancy can be increased with this Paraglide medication. It can extend their life for about 4.5 to 8 years, but their life expectancy does depend on their response to that medication. Without the treatment, they can only have like months to years, depending on the severity of the disease when it is diagnosed. And like I said, oftentimes it does go undiagnosed frequently, but ultimately a lot of the time they end up passing away due to reoccurring laminitis, or they get an injury or disease that they are unable to recover from due to their decreased immunities and lack of immune response. The future for these horses in curing Cushing's disease is promising because horses are living a lot longer now, and senior horses are being kept as companion animals. Research in the past 40 years has increased and is expected to continue to increase as these horses are living longer. Cushing's disease is becoming more common because there's more senior horses, and so hopefully we'll find a cure in the near future. But sadly, like many neurodegenerative diseases in humans and animals, right now it remains uncured. And finally, these are the images of Willie now that he's in his early 20s and he has been diagnosed with Cushing's. He's been on his medication the entire time. This is him in this photo. You can tell that his body condition his muscle tone has decreased. He's not in as much work anymore, but he doesn't have as bad of a pot-bellied appearance. His top line isn't super skinny. He also is doing okay with his hair coat. He does have long hair, but he should be clipped. And overall, I feel like he's living an okay life, and I'm glad that he has the Paraglide medication to help maintain his quality of life. And yeah, that is all. So thank you.